Etiology of cancer. Is cancer an only disease or a group of diseases with similar characteristics? The answer to this question has an essential importance. It is cancer or cancers. As we have previously said, it seems logical to refer to cancers due to practical reasons, but intimately, each one of us fights against a monolithic and at the same time simple enemy, representing only a group of cells which do not accept the natural order and provoke innumerable disorders where they develop. The value of etiopathologic factors is not the same for a doctor as for a biologist. For the latter, cancer is an only disease, with the same characteristics either in cancerous cells of a hen, a rabbit, a mouse, or a man. Biological indifferentiation, exasperated multiplication, and growth autonomy. The reversibility of certain tumors or their transformation into others would back up the hypothesis of an only cancer. Certain neoplasms of plants, teratomas, develop into totally normal plants. Some neuroblastomas develop into benign ganglioneuroma and the normal tissue. Consecutive transplants of epitheliomas develop into sarcomas. If we accept as valid the concept of an only cancer in order to formulate a theory about etiology, we should agree with the criterion proposed by Bost. Every neuroplastic growth forms, however multiple and diverse they may be, are but variants of an only and same process, to such an extent that a cause able to explain one should explain all of them, and as a consequence, it is necessary to reject every etiological theory of cancer which cannot explain the entirety of neoplasias. On the basis of this criterion, it is theoretically possible for virus and chemical substances to have a constant intervention in all cancer's varieties. But if chemical substances were the main factors of canceration, they would have to participate also in those cancers caused by virus. We should therefore admit that viruses act indirectly when they provoke the formation of cancerogenic chemical substances. But this is in formal contradiction with the fact that some viruses are able to cause canceration in the cell faster than any of the well-known chemical agents. Thus, the virus would be in the first place as a cancerogenic agent. We could speculatively accept this conclusion, but we would need a theory which explains by which mechanisms viruses act in the genesis of human cancers. Meanwhile, we allow ourselves to resume the irritative theory which enjoyed an exaggerated prestige at the beginning of this record and which later, due to the fact of considering the irritation as a promoting factor, was absolutely left out. We will not simply speak about irritation, but also about a certain quantity of irritation. What will be important indeed is not irritation itself, but the quantity of inflammation, regeneration it will generate. The problem would be in a factor of quantity of inflammation, not ponderable, which we will call dose cancer. The etiology of cancer could be given by a type of cellular response to a certain behavior of a tissue in the presence of a cancerogenic noxa, as in the case of a radiated zone which, once disappeared the stimulus, is the base of neoplasia after some years. In this case, radiation would have not been what generated cancer, but the permanent effects which were caused on the radiated tissue. We do not know if the radiation has an additive or synergetic effect over other cancerogenic substances. When reaching, as time goes by, dose cancer, the genetic behavior which generates the malignant nature would be indirectly determined. It is not possible, in this case, to prevent the future malignancy, as it occurs with the chemical cancerogenics. These ones would cause inflammatory reaction per se, and on them would it depend the getting to dose cancer. If their application were interrupted before what is considered necessary, carcinogenesis would not be generated. According to this criterion, we divide carcinogenic agents in two groups, depending on dose. Only dose. The irritant agent produces a permanent lesion in the tissues or the cell. Dose cancer will be unavoidably reached. The process is independent of the irritant agent. Dose by accumulation. The irritant agent should act continuously and along a certain time. If its action is interrupted, carcinogenesis is not generated. In time, both groups may be influenced by exogenous factors, fasting, overfeeding, isolation, stress. With hypocaloric diets, chemical carcinogenesis is not given in experimentation animals. With restricted diets, there is not spontaneous cancer in mice breast adenocarcinoma, 70% of incidence. In isolated mice, the incidence of lung metastasis of subcutaneous grafted adenocarcinoma in bulb C mice is modified with a P0005. Carcinogenesis model. On the base of the genesis of skin or mucous membrane cancer in situ and its subsequent functional malignancy. Any irritant provokes an inflammatory response and, a long time, this response demands an unusual, exaggerated behavior from the basal membrane, which makes this order remain printed at a certain moment on the genes of the epithelial cells and escape from a normal control. Now, having disappeared the irritant stimulus, the cellular lack of control itself becomes so, which will continue to irritate and inflame the dermis. This inflammation erases the basal membrane, and this is the moment when the tumor becomes malignant and starts to feed on vascular neoformations proceeding from the dermis. This explanation is so simple that it provokes a logical reaction of rejection. But let us try to demonstrate it is not possible. Let us observe what happens in any attempt of regeneration of traumatic lesions in skin and mucous membranes. The inflammation erases the basal membrane and allows the formation of the cicatricial tissue through vascular prolongations and sending all the contribution necessary for the formation of regeneration tissues. Why not in cancer? The only difference is that it will not be beneficial for the organism, but for the proliferation of the tumor, infiltration and metastasis. This model divides the carcinogenetic process into two stages. 1. Dependent on an irritant. At this first stage, the inflammation plays a role of mutant factor, generating the genetic carcinogenesis, cancer in situ. 2. Autarkic stage of promotion. Cancer in situ, in its continuous growing, allows the inflammation to play its most important role in this process, to be the responsible one to functionally make the neoplastic cellular process malignant. It becomes a cancerogenic factor. At this last stage, it is possible to act more effectively both in the prevention and control of the evolution of the disease. Promoting agents would be determinant of malignancy. It is possible to make some cells of the bladder malignant with N-methyl, N-nitrosourea, MNU, but for the process to become clinical, functional malignancy, it is necessary to supply saccharin in the diet 6 weeks before and locally 48 weeks after the MNU. Direct genetic carcinogenesis. It is not essential for the inflammation to be the mutant factor at the first stage of this model. The virus, chemical products, and radiations by direct mechanisms may provoke the genetic carcinogenesis. This does not alter the value of this theory, since the next step of functional malignancy is independent of the mutant factor and the inflammation will continue to be responsible for the genesis of cancer. Coincidentally, this direct genetic carcinogenesis was the responsible one for the irritative theory to have been totally left out, because it was not possible to understand how, for example, the injected 3 and 4-benzpyrin provoked sarcomas and not so the 1 and 2-benzpyrin, being its structure almost similar and therefore its action as an irritant the same one. Without the irritant factor, experimental tumors were produced. Then a generalization was reached that factors which lead to cancer must act on the cells. Since irritation is not a cellular phenomenon but a tissular one, a distinction was made between irritative action and cancerogenetic action. Of course, after this, there has not been much advance as regards the etiology of cancer. We can thus recover the irritative theory, since no other has been formulated which may displace it as regards the explanation of experimental and clinical facts, as the greatest objection to it may fit the model of this theory with the following reasoning. Promotion of cancer by an irritant is feasible, although its initiation may have been provoked by virus or chemical products in direct actions on the cells. In the last resort, that cellular differentiation we know as neoplastic cell will need the organism to be able to develop, divide, expand, and generate metastases. That dependence is a fact which seeks to be stressed in this essay because it is the most vulnerable point the disease presents. It is true that day when we get to find the biophysical and biochemical mechanisms which allow us to get to the bottom of the reason of the existence of malignant cells, we will solve the problem of cancer. But I wonder whether we may have chosen the most difficult way and, what is worst, without a reliable theoretical support. Since all the cells in an organism contain the same genetic heritage, it is feasible to suppose that cellular differences we observe in any living being, including tumor ones, may have been a consequence of the incidence of multiple factors. Among them, the most important ones are the quality of cellular enzymes, the interaction between the cells and the influence of environmental conditions, excess or scarcity of nutrients, effect of irritants, tenor of oxygen, etc. These factors would condition the evolutive cycle, and this fact may be a determinant of the malignancy. Cellular differentiation would be acquired not only through the transmission of the genetic information, but also through the contact with other cells. There would thus be an interaction between the genetic information and the environmental influence. It is only a question of accepting that the evolution exists. The neoplasia would be, thus, a disease of the differentiation. Abnormal differentiation of a normal genome. This is the reason of the possible reversibility of a malignant process. Physiopathology. Let us reckon from an already established neoplasia without considering its etiology. It is almost unanimously accepted that the characteristic of generating metastases is what determines the malignant quality of tumors, though it does not agree, in some cases, with the histopathological criterion which was determinant not long ago. If a tumor has the capacity to generate metastases, we can speak about cancer. It is also accepted that the cancerous tissue behaves as any other organ in the organism, and it is ruled by the same laws as the others are, reason why the defense mechanisms do not attack it. If they do, they achieve very little effectiveness. What we call tumor tissue is a group of neoplastic cells, normal stroma, and neovascularization, also normal, supplied by the organism. This tumor tissue has two characteristics: infiltrating and propagating to distant places. The first one is achieved by simple expansion due to the high index of reproduction and growth. The metastasizing capacity by mechanisms which have not been perfectly explained yet, and in which the little cellular cohesion, the great mobility of those cells, and the presence of a great vascularization are important. How do we explain the destruction of surrounding tissues? How do we explain that the groups of tumor cells may penetrate lymphatic and blood vessels? An attempt to explain these phenomena is the formulation of this theory, on the basis that every expansile growth will produce inflammation. We say, 1. This inflammation, and not the tumor, will provoke the cellular lysis as it occurs in all inflammatory tissues, not being the action of the proteolytic enzymes liberated by the tumor necessary. 2. The inflammation supplies an abundant nutrition to the zone for the constitution of the stroma and the neovascularization the tumor needs in a vital way, without the existence of the tumor angiogenetic factor being necessary. 3. In any inflammation, it is common for the lymphatics to filtrate rests of tissues and cells through pores, which are made manifest only when these vessels are within inflamed tissues. In the inflammation which surrounds a tumor, growth allows the explanation of these phenomena. Why do we grant sensational attributes to the tumor which are at the same time illogical, such as the destruction of surrounding tissues of the secretion of competitive substances to nourish itself, or the secretion of others which ordered the organism to bring to it an abundant net of blood vessels? Let us remember the scientific concept which advises to go to the simplest and most logical when the option exists. We accuse the inflammation of being by itself responsible for functionally making a tumor malignant. It is convenient to say that the genetic carcinogenesis existence is valid. It is also logical for these cells to be, as a consequence, immunologically different from the normal ones. We do not seek to deny facts which have been scientifically proved, but to formulate a theory where all these facts may fit. The inflammation produced by the tumors is regarded as a secondary factor or simply ignored. Once the inflammation sitting on the defendant's seat, let us see if it would be able, by itself, to create the conditions necessary for a cellular growth which is out of control, genetic carcinogenesis, to be able to infiltrate and, what is worse, propagate to a distance, functional malignancy. The tumor, in its constant growth, would act like any other noxa, generating an inflammatory process as a response. This inflammatory process, however, would have performance as a characteristic as the tumor grows constantly. Summarizing, the inflammation has an acute nature, although for the patient it is chronic according to its duration. Of course, the inflamed peritumor tissues are not always the same ones, as they gradually die around the tumor due to the impossibility to perform the process of resolution of the inflammation. This creates the ideal conditions for the tumor to grow at ease and receive nutritional contribution as it occurs in any inflammation. The difference lies in the fact that in this case, that contribution is not useful to restore tissues, but to nourish the tumor. This permanent and acute inflammation provokes a chain of facts which are causes of cancer, and which, a long time, could cause by themselves cachexia and death. We will briefly say that some of those facts are increase of the suprarenal cortex, increase of corticosteroids, liberation of cellular deposits of amino acids and fats as a logical consequence of the increase of the suprarenal activity, anti-inflammatory effects, immunodepressant effect, Cushing syndrome, increase of the gluconeogenesis and glycemia. Such pathogenesis, present in every patient with cancer, is also observed in the cicatrization of wounds, regenerating processes, traumatisms, and with the injection of necrosing substances. Paraneoplastic syndromes, which do not directly answer to effects which have been induced by specific secretions of certain tumors, or the simple invasion of organs, or the treatment of cancer itself, could be a consequence of the inflammatory regenerating response to the tumor growth. This constant growth in the organism has only one similar case given by the behavior of the syncytial trophoblast. As a physiological and normal infiltration subject to definite limits. But it is known that there are some pathological alterations which lead to infiltrate not only the spongy layer of the endometrium, but which also come to get into contact with the myometrium, placenta creta, to infiltrate it, placenta increta, and even to eat it and pierce it, placenta percreta. Could we imagine the behavior pattern of the syncytial trophoblast if the normal hormonal levels of the pregnant woman persisted? The metastatic capacity of the trophoblastic cell has been observed in patients who died in the last months of pregnancy. Pregnancy, as a phenomenon subject to hormonal controls, determines the death of those metastatic cells when the gestation period concludes. This collateral hypothesis should be faced with the exposed theory, since it is possible for many of the phenomena we grant to cancer not to be as exclusive of it as we believe. Role of the inflammation at every step of the progression of the disease. Number 1. The tumor breathes basically through anaerobic glucolysis. It needs, thus, a quantitatively important energetic contribution. How would it obtain it if there didn't exist another tissue around it, like the inflammatory one, which also breathes through anaerobic glucolysis and which, through extravasation and other phenomena share this contribution to it, we should think that the tumor picks up glucose through a mechanism we do not even imagine. Number 2. The malignant tumor creates a nitrogen trap. How would amino acids get to its interior but for the habitual conditions which make this occur in any inflammation? 3. The malignant tumor requires for its growth to be accompanied by a big vascular net and a conjunctive support. Would it not be deducible that the inflammatory phenomenon in its attempt to restore could bring the tumor its nutrition and support? It would be simpler than assuming that a tumor angiogenetic factor could be responsible. If this existed, it could not be pleased if the capacity of the organism to form the vascular net did not exist. This is demonstrated by the fact that the tumor which is grafted in an avascular zone, anterior chamber of the eye, remains in a latent life. Number 4. In order to generate metastases, it is necessary for the tumor to invade blood vessels or for some groups of cells to enter the lymphatic or blood stream. How can we explain that a lymphatic vessel may introduce in its light such a great number of cells as it is the one considered critical to produce metastases? In an inflammatory environment, it is possible for this cellular group or isolated cells to penetrate into the lymphatic or blood stream. Number 5. Some groups of tumor cells concentrate in some ill people's organism without most of them being able to develop a metastasis. What is the reason for some of them to achieve it? Let us suppose that some malignant cells circulate with blood. It is said that there are 3 possibilities for them to become viable. A. Forming a tumor thrombus and infiltrating the nearby tissues from there. B. Escaping to the exterior of blood vessels. And C. Adhering to injured endotheliums. A. Taking into account that the cells circulate with their pronounced negative charge along the center of the vessel, like the white elements of blood, there are few possibilities for them to become fixed to the healthy vascular endothelium. If they circulate along a vein, as its diameter increases in the journey, they will not have the possibility to obstruct it, and they will only get to stop when they pass through the lung. If they circulate along an artery, they might obstruct it. In this case, the tumor cell has few possibilities, or perhaps not even one, to invade, since they do not attack the arterial endothelium. They are surrounded by fibrin and reabsorbed. If this were not so, the metastasis distribution would be more uniform and in any part of the organism. B. The second possibility would be given by the passing of the tumor cells through an inflamed zone in any part of the organism. The margination, extravasation, and finally the implantation would be produced, together with the white elements of blood, in a highly favorable environment. Acid pH, anaerobic glycolysis, theory of the seed and the soil. The changes in the microcirculation, due to the inflammatory process, determine the loss of laminar bloodstream, which favors the margination and the diapedesis stimulated by chemotactic factors. Once the tumor thrombus is in an inflammatory zone, with gradual slowness and finally blood stasis by coagulation and fibrinogen, it will find the adequate environment for its viability. This would explain the reason for the little quantity of metastasis compared to the circulating cells and the few localizations. Not every organ lives with constant microinflammations. It is important for the zone to be invaded to suffer constant inflammations, not circumstantial ones, since the time the tumor would need to be implanted could be longer than that of an isolated inflammatory process. Thus, we could explain why the spleen, although being the principal blood filter, does not usually generate metastases, while lung and liver very frequently do. It is interesting to observe how it is feasible to experimentally generate metastases only by producing traumatisms on the spleen, liver, and limbs. C. Our last possibility is the addition of tumor thrombi to injured endotheliums covered with fibrin and blood platelets, as Chu and colleagues do prove. In this case, there was already an inflamed zone in the endothelium before the tumor cells adhered to it, surely by similar mechanisms to the former case. Loss of lamina stream, gradual slowness, and blood stasis. If inflammation did not exist, it would not be possible for the tumor to generate metastases.